Hey everybody, Joe Joseph here for thedailysheeple.com, and this is your news shot. I'm going to go to investmentwatchblog.com. This is something that I bet you people don't know much about, especially from my generation forward, as we don't really remember how it used to be before the healthcare industry really existed. Did you know that before 1973, it was illegal in the U.S. to profit off of health care? That the Healthcare Maintenance Organization Act of 1973, passed by President Nixon, changed everything. And this, my friends, is why the shameless pander to robber baron corporations posing as health providers, and why it's so egregious and obvious their tactic to do nothing more than plump up insurance company profits. That's exactly what this health insurance business racket is doing. And do you know who's to blame? It was President Nixon. In 1973, Nixon did a favor, a personal favor, for his friend and personal campaign financier, Edgar Kaiser, then president and chairman of Kaiser Permanente. Nixon signed into law the Health Maintenance Organization Act of 1973, in which medical insurance agencies, hospitals, clinics, and even doctors could be functioning as for-profit businesses and business entities instead of the service organizations they were intended to be, and which insurance companies got the first taste of the federal subsidies to implement HMOA 73? Why, it was Kaiser Permanente. Now, what could possibly be the odds there? I mean, come on. And to perfectly cement HMOA 73 as the profiteering boondoggle that it actually was, the law Nixon mandated also included clauses that encourage medical providers not to cure afflictions, but to prolong them by treating the symptoms, meaning there's no money to be made in curing sickness. But the sky's the limit when it comes to forcing people to endure repetitive doctor visits, endless tests, and of course, let's not forget the ever-increasing demand for American-made prescription drugs. Have you ever noticed recently that the words prolonged coma and death have wormed their way into the fast-spoken side effects listed on just about every new drug that you see on television and radio? Death. From medicines, of course, that are supposed to cure you. And you know what? People will take restless leg over death. It's true. So it's an arms race between insurers who deploy software and manpower trying to find claims that they can reject, and doctors and hospitals who deploy their own forces in an effort to outsmart or challenge the insurers. And the cost of this arms race ends up becoming borne by the public in the form of higher health care prices and higher insurance premiums. Of course, rejecting claims is a clumsy way to deny coverage. You know, the best way for an insurer to avoid paying medical bills is to avoid selling insurance to people who really need it. An insurance company can accomplish this in two ways, really. Through marketing that targets the healthy, and through underwriting, rejecting the sick or charging them higher premiums. See the pattern? There's a big pattern here that's emerging. So, people need to understand the truth. When we start talking about healthcare and how to fix it and everything else, about where it went off the rails. And it started going off the rails in 1973. See, President Nixon should be going down in history as probably one of the worst presidents, if not the worst president ever to sit in the office of president. I mean, that guy did more damage to this country in such a short period of time. And damage that lasts, when I say decades, I mean decades. And you're talking about institutions now with so much power, so much lobbying might, that it will be damn near impossible to get rid of these people, to get rid of these companies. Because everybody now has it ingrained that they need health insurance to live, to be able to afford things, when in reality, all we all have to do is just say, we won't participate. We don't want health insurance. Stop. We're not going to do it. How much is cash? Tell me what the cash price is. See, eventually they're going to say, well, the cash price is $50,000. Well, nobody can afford $50,000. So you can ask for $50,000 all day, but if nobody's going to pay it, The old adage, of course, is something's only worth what somebody's willing to pay for it. Well, we don't have a free market in healthcare, or any semblance of a free market in healthcare, because there is none. There's no way for you to go out and shop to see who's cheaper or maybe who provides a better service. No, you have to go to the people that your health insurance says it does. You know, when you get an oil change on your car, do you use your auto insurance for that? Or is auto insurance for catastrophic events like accidents or perhaps personal injury as a result of, the car ran over me while I was doing the brakes? I don't know, anything like that, you know? That's what auto insurance is for. Auto insurance doesn't cover oil changes. Oil changes is standard maintenance. Standard maintenance should not be paid for by health insurance. We should not be charging, or primary care physicians shouldn't be charged $300 for a visit. Or they shouldn't be charging $300 for a visit. You know what I mean? It's crazy. $50. And now you don't have to do any of that paperwork. You don't have to have the staff just to fund the unbelievable amount of overhead required to handle these health insurance claims. 1973, folks, the Health Maintenance Organization Act. That, my friends, is where it went off the rails. And if you want, check it out, the HMOA 73, and check it out. And then take a look at the current legislation that's out there in Congress, or even single payer that Bernie Sanders pushes, and ask yourself, does this fall within the spirit of the HMAO 73, or does it fall more in line with how it was prior to 1973, where you had doctors basically that worked for cash, and then you had catastrophic coverage for insurance. Meanwhile, the health sector was not a for-profit sector. So let's take a look at that. I look forward to your comments below, and check out thedailysheeple.com, and I'll see you all again real soon. # wake the flock up. Have a great day, everybody.